The topic we chose is the statement that sometimes the treatment is worse than the disease. We chose schizophrenia and schizoaffective disorder and their treatments as the examples for our discussion. Before expressing our views on this statement, we need to briefly introduce the disease itself, its treatments, and the serious side effects caused by the treatment. Schizophrenia is a serious and disabling disease, and its main symptoms are divided into three categories, which are the positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms refer to symptoms that healthy people do not have, but patients have, including hallucination, delusions, disorganized speech, and disorganized behavior or catatonia. Negative symptoms refer to functions that healthy people should have, but patients lose, including loss of emotional response, anhedonia, and apathy. Schizoaffective disorder is only determined when the patient meets the criteria for schizophrenia and a major mood episode at the same time, including depression type, bipolar type, and mixed type. About 1% of the population will suffer from this disease, and men are more susceptible than women. However, women develop the disease later than men, with the first peak in their late 20s. In the early 20th century, women married and had children early, and some female patients develop the disease after becoming pregnant and having children. The onset of this disease is affected by genetics, and due to the environmental impact caused by the World War, the number of patients is growing large. Therefore, the treatment method need to be discovered. Before the discovery of drugs for schizophrenia, some more radical treatments were used. These included insulin coma therapy, malaria therapy, and electroconvulsive therapy. Insulin coma therapy involves repeatedly injecting large doses of insulin into the patient to produce 30 to 40 times hypoglycemic comas. Some patients have reported a certain degree of recovery after using the treatment, but the side effects are more significant. Before the coma after the insulin injection, the patient may convulse due to the extremely low blood sugar and may be induced to epilepsy. Also, since the source of insulin is often livestock such as pigs, cattle, and sheep, people who are allergic to these animals may have an allergic reaction to the injection of insulin. Possible fatal conditions in coma include dyspnea or suffocation, bradycardia, atrial fibrillation, cardiomegaly, vomiting which may lead to suffocation. In addition, the patient may be at risk of not waking up on time, which is the prolonged coma. Malaria therapy is probably the worst treatment. It involves infecting the patient with malaria that causes changes in the patient's metabolic and nutritional status, which may help improve the patient's mental state. But in one study, it was reported that no schizophrenia patient had any improvement in the general clinical condition 6 months after the end of treatment. In addition, 2 patients died from malaria during treatment, and 1 patient became worse because latent tuberculosis became active. Electroconvulsive therapy is still used today because of its remarkable efficacy, but its side effects are also quite obvious. Some patients have experienced anterograde amnesia or retrograde amnesia, loss of appetite, nausea, headache, confusion, and other symptoms after treatment. Also, due to the passage of electric current, ECT has the risk of causing tachycardia, arrhythmia, hypertension, and cardiac arrest.
The first generation of antipsychotic drugs such as chlorpromazine primarily exerted therapeutic effects through the antagonistic action on dopamine D2 receptors. Chlorpromazine belongs to the first group of phenothiazine class drugs and is relatively inexpensive. However, this class of medications is associated with significant side effects, including pronounced sedative effects and extrapyramidal side effects such as tremors, rigidity, and bradykinesia. Due to these severe side effects, particular movement disorders, second-generation antipsychotics are typically prioritized as the preferred choice in modern treatment. These second-generation medications generally induce fewer movement disorders, making them more favored in treatment. The second-generation antipsychotic medications not only exert effects through the antagonism of dopamine D2 receptors, but can also bind to other receptors, exhibiting a broader mechanism of action. For instance, clozapine is considered the most effective medication for treating refractory schizophrenia. However, it is usually reserved as a last option due to the risks of severe side effects such as agranulocytosis, cardiac issues, and effects on the parasympathetic nervous systems. Agranulocytosis can be extremely dangerous. Due to these specific side effects, the management of clozapine differs from that of other psychotropic drugs. Although olanzapine is effective, it has strong sedative effects and is associated with a higher risk of hypoglycemia and antimuscarinic effects. Haloperidol has higher risk of APS and weight gain. Quantapine is characterized by strong sedative effects and antimuscarinic effects, which may lead to symptoms such as drowsiness in patients.
Patients with schizoaffective disorder may also need to take antidepressant. Some reuptake inhibitors, the SSRIs, SNRIs, and NRIs, may cause the self-harm or suicidal ideation in the early stage of use. Tricyclic antidepressants also have a high suicide mortality in overdose. These drugs can be said to have high risks due to the unstable mental health of the patients.
Walter Freeman, the neurologist infamous for popularizing lobotomy, represents one of the most controversial figures in medical history. Despite lacking for formal surgical training or a license to perform operations, Freeman pushed forward with his radical approach to treating mental illness, often disregarding ethical and professional standards. He even enlisted unqualified assistance, including a newly graduated medical student, which helped him during his operation. The transorbital lobotomy was quick, but crude, and often taking mere minutes to complete. Freeman would use an ice pick and a hammer to penetrate the skull through the eye socket, severing the neuron connections in the frontal lobe. And this procedure was performed on thousands of patients suffering from the conditions like depression and anxiety. Many of them were institutionalized or unable to consent. The aftermath of these strategies were devastating for many patients. While some showed temporary improvement in symptoms, others experienced severe side effects such as emotional numbness, cognitive impairment, personality changes, or even death. Many patients lost their ability to function independently and required a lifelong care. Freeman himself seemed indifferent to these outcomes, and he reportedly performed multiple lobotomies on some individuals when their initial results was unsatisfactory.
Although today's antipsychotic medications still have many side effects, there has been significant progress compared to the lobotomies of Walter Freeman's era. These medications are more scientifically effective and offer better guarantees in terms of safety and ethics. Current therapeutic drugs are designed based on pathological mechanisms, targeting specific goals such as dopamine in the brain to restore neurochemical balance. The use of modern psychotropic medication typically requires patients or their guardians to be fully informed and consent to treatment. Before prescribing medications, doctors also need to explain the effects of the drugs, the side effects that may arise, and the associated risks. However, at the same time, there are still many disadvantages associated with medication. Withdrawal symptoms, medication dependence, and delayed treatment response are significant issues associated with the use of psychotropic drugs. Many patients may experience withdrawal symptoms, such as headaches, when discontinuing the medication. They may also experience a recurrence of their condition after stopping the medication. Simultaneous treatment needs to be individualized as each patient's situation is different. For patients with chronic schizophrenia, attention should be paid to medication dosage, as high doses of antipsychotic drugs may have a negative impact on cognitive function. Delayed treatment response is also a challenge, as the effects of medication do not take effect immediately. The regulation of neurotransmitters and the restoration of neural circuits is a gradual process, often requiring several weeks or even longer to have a significant impact on symptoms. All these factors can contribute to patients' non-compliance with treatments. Therefore, there are still many potential issues with antipsychotic medications, and while we have indeed made progress in treatment, this process has also brought many new problems. This compels us to reflect whether targeted disease is getting it worse.
As we conclude to this presentation, I want to leave you with a powerful thought. The cure itself can be worse than the disease. And this idea is vividly illustrated in this diagram. It challenges us to think deeply about the impact of medical treatments, because not only the patients, but also on their families, stress on the doctors, and the society as a whole. At the heart of this diagram is the patient, obviously, and for them, the disease is undeniably terrible, but the treatment itself has a long-term impacts. Can sometimes feel even worse. And imagine doing a therapy that strips away your sense or yourself and leaves you with an irreversible damage. This raises an important question. Are we truly helping patients if the process of the healing becomes another form of suffering? And this paradox underscores a recurring challenge in medicine, the tension between innovation and well-being. While advancements are necessary to address complex disease, they must not come at the expense of patients' dignity and well-being. On other perspectives, the patients' families, they have to watch their loved ones suffering and also making the hardest decision. The doctors also burden stress when doing operations or giving treatments. The public society at large, many people remain ignorant about treatment methods and their side effects. Instead of understanding or emphasizing with patients, society often focuses solely on whether the patients are harmful or not, whether they possess a threat to other people, rather than carrying their source of suffering. All these informations, they conclude into one point. Treatment is not just about curing disease, it is about preserving humanity. And as we move forward, as the society develops, let us commit to create a society that values compassion over convenience, understanding over ignorance, and dignity over indifference. Only then we can ensure that no cure ever becomes worse than the disease itself.